In just a few minutes, we expect to get new analysis from the Congressional Budget Office about just how many Americans could lose their health insurance if Republicans pass President Trump's mega bill. Joining us now, Democratic Congressman Brendan Boyle, who has seen the report and can share what is in it exclusively. So, Congressman, I know this report isn't coming out till the top of the hour, but you have read it. What does it say?
Yeah, well, good to be back with you. And I can tell you we already knew that at least 13.7 million Americans were going to lose their health care as a result of this bill. That estimate done a few weeks ago by the CBO was before those last-minute changes that House Republican leadership made in order to win over the votes of a few of their holdouts who were some of the most hardline conservatives in the Republican conference. Because of those last-minute changes, now it is confirmed 16 million Americans will lose their health care as a result of this big Republican bill.
We haven't seen the CBO report, as I stated. You have, because it isn't officially out for another 15 or 16 minutes. This morning, the CBO said, it was just one line in another statement about the mega bill, that the legislation would lead to 10.9 million people losing health insurance by 2034. So is the difference every time there is some sort of adjustment made to the bill that's known about, that number changes, but bottom line, it's significant?
Yeah, and I know people can get lost with these numbers. So just to explain it as simply as possible, the 10.9 million is correct, but that's just regarding Medicaid changes and losses from Medicaid. When you add on to that 5.1 million additional Americans who will lose their health care because of Republican changes to the Affordable Care Act, that combines to the 16 million. But look, really, here's the bottom line. Millions and millions of Americans are going to lose their health care so that 1/10 of the top 1% of Americans, a few thousand of the richest people on earth, will be able to get tax cuts. That's really the trade-off. It's 16 million Americans losing their health care to pay for tax cuts to some of the wealthiest few thousand Americans in the country.
Yesterday, I happened to speak with the CEO of a rural health care system in Colorado, covers 50,000 people, who explained to us the ripple effects that would follow the loss of health care. Here's what she told me, Congressman.
When they lose coverage, they don't lose the need for health care. And so those patients would wait till later in their disease process, wait till later in their illness. They would show up at our emergency room. It would be a crisis on our healthcare system. And we just, as a rural hospital, would not have the resources to take care of them. So it would be devastating to our rural healthcare system.
We have heard repeatedly from folks who are experts in the business that rural hospitals could be the first to be affected. And when I say affected, closed. Are you hearing anything from your Republican colleagues, because rural areas tend to be red areas, anything at all that suggests that they have the concern about what the impact would be on people, on hospitals? And by the way, for a lot of those hospitals, they are the major employer in the entire area.
You know, I'm so glad that you showed that clip of the provider talking about the impact on their hospital, because it's a reminder that, yes, 16 million Americans losing their health care as a result of the Republican bill, changes to Medicaid and the Affordable Care Act. That is awful and egregious. But it's actually not just the 16 million Americans. It is the millions more who will be impacted, that the next time we show up to the ER, if there's something wrong with my daughter and we have to rush to the ER, suddenly that emergency room is overwhelmed because folks who lost their coverage are now not getting the coverage they need, not getting the care they need. Their problems and their health care is not being treated in a preventative way, and then suddenly they use the ER as a last resort. So really, this will impact all of us, especially, I think, those hospitals that are in rural areas that were already teetering, as well as those of us who represent urban areas that likewise have a lot of health systems that are really just on the edge right now of survival.
Congressman Brendan Boyle, thank you for giving us the exclusive first look at the Congressional Budget Office estimate of what would happen to health care and the 16 million Americans if this mega bill goes through. Good to see you again. Thank you for your time.
Thank you.